Hello, and welcome to our panel this afternoon. My name is Adamika Arthur, and I'm the executive director of a nonprofit called Health Tech for Medicaid. We essentially bring payers, providers, policymakers, entrepreneurs, investors, and people who are vulnerable in this country together to scale and innovate in the Medicaid space. Medicaid is one of the largest healthcare providers in this country. It's a government payer program that's a state and federal partnership. And I'm thrilled to have the honor to moderate today's panel as we're here to talk about the very important intersections right between healthcare delivery, investment in digital health tech, and specifically health equity as it pertains to maternity care. So kind of given the explosion in digital health investment with almost incredible record deals in 2020 alone, this is kind of a moment where it's kind of long and overdue. We often don't have these conversations around the intersection between public health challenges and how public, private, and philanthropic relationships are here to kind of invest in this kind of real, actionable issue. So we're here to talk about what you guys are doing, and we have three outstanding panelists working at this intersection to share their insights. And so I'm going to kind of just go and have everyone introduce themselves. How does that sound? So first, why don't I start with you, Leah?
Thanks, Adamika. Hi, I'm Leah Sparks. I'm the CEO and founder of Wildflower Health. We're a technology-enabled company focused on the full spectrum of women's health, with a lot of focus certainly on maternity. We work with both health plans and providers to advance new care and payment models to improve quality and outcome in women's health, and it's great to be here.
Thanks. Juan Pablo, what about you?
Awesome. Hello, everyone. Juan Pablo Segura, one of the founders of Baby Scripts. At Baby Scripts, we singularly are focused on rethinking how pregnant women receive their care through digital and virtual tools. So our big goal is to make prenatal care and postpartum care available at any time and at any place.
Fabulous. And last but certainly not least, Owen.
Yeah, so Olan Shurmak, and I'm one of the co-founders of a startup that is truly sort of focused on providing maternity support services for Medicaid and underserved populations. And we truly sort of take an approach of technology, but combined with in-person and people-driven care to truly bring care and support women along the maternity journey, be it prenatal and postpartum.
Excellent. So I'm just going to start. I mean, each of you guys have very different backgrounds, and I'm interested in knowing, how did you get to this focus on kind of health equity and underserved communities? What led you to kind of choose this as a vehicle for your business? And how are you using technology to kind of advance health equity in your companies? Maybe I'll start again with Leah.
Yeah, great. I've worked in healthcare for 20 years, and when I started this company 8 years ago, I was on my own journey as a first-time mother, and really for myself was the first time I was dealing with a healthcare system. And I was really amazed, as even someone who was well-educated and actually worked in healthcare, how confusing and difficult it was to navigate the system. And then sort of taking a step back and surveying the literature on the economic burden and just the burden on families when you look at the safety rates of pregnancy in the United States, the quality and the outcomes, infant mortality. I mean, all of the metrics are subpar compared to the rest of the developed world. And I just realized it was a huge opportunity to really transform first the patient experience in a way that plugged into healthcare, so that we could leverage technology to really be an extension of the healthcare system and help providers better monitor for risk, drive prevention, and escalate when issues arise. And candidly, we've made a lot of progress as a company. But candidly, I'm still dismayed and I'm still frustrated, because since we started Wildflower in 2012, the preterm birth rate has gone up in this country. Maternal mortality is still horrific. And we know Black women die at rates of 3 to 4 times that of white women. And so, I think there's still a lot of work to do. I think as we get into this discussion, it would be great to look ahead and talk about, what is really possible as this industry has matured. But really started with my own journey and looking to address it. And I should just say that when I started the company, I never dreamed what a great opportunity it would be to work in Medicaid populations. Adamika just described what an important population that is and what a big insurance program it is in the country. And one of the things that we have found is that we work with both Medicaid and commercial privately insured clients, but our Medicaid clients have the biggest impact on outcomes, the most engaged users. And so, there's sort of a myth to dispel that underserved populations don't use technology, because they certainly do. And that's a big part of, I think, the solutions going forward.
Yeah, and we're going to talk about that myth busting a little later. Juan Pablo?
Yeah, I agree with all of the challenges that Leah shared. I think what's important in our journey in this space is we're based in Washington, D.C., and a lot of what pushed us to start Baby Scripts and even, do work, we've always kind of thought about and wanted to plan and do tech experiences for moms in Medicaid. But a lot of what was happening around us, so not a lot of people know this, but right now in Washington, D.C., if you live on the east side of the city, you do not have an L&D to go to. So the L&Ds that were there were shutting down. And the only way for moms, and particularly Black moms, because a majority of the east side of the city is African-American, if you wanted to deliver or just get prenatal care, you had to take 4 buses and 2 trains to just see your provider for 5 minutes. And so, we thought that was unacceptable. And so when we started the company, a lot of what we were focused on, like I shared in the introduction, was, hey, how can we make care more seamless? Why does a mom always have to go to the doctor in the office to get care? And what's really been great about our journey is that the problems that Black women are facing in Washington, D.C., they're not singular to that community. It's all over the country. 52% of counties don't have a practicing OBGYN. More than that, don't have a practicing nurse midwife. So as we think about kind of the infrastructure of prenatal and postpartum care, it just doesn't exist. And really the only way to solve that is through technology and through innovation. So that's kind of what started our journey a little bit.
Yeah, thank you. Olin.
Yes, I think that's a great question. I agree with Leah and Juan Pablo. For me personally, I'm an emergency medicine physician. Did most of my practice in New York and Philly. And, I spent a lot of my time early in my career thinking about sort of, how do you provide sort of acute unscheduled care to different populations? And the great thing about the emergency department is that you see a population that has need, and you see the gaps that currently exist in the U.S. healthcare system. And I think many a times in the emergency department, you always came across patients where, they came in for a complaint, and in the traditional healthcare setting, right, you focused on, are you having an emergency or not? And you put them through the sort of emergency department engine. And at the end of the day, you sort of sent them home and you said, go follow up with your OBGYN. And the fact is, a lot of those patients return to the hospital over and over again. A lot of those patients' sort of whole person health was never addressed. The anxiety, the concerns, the worry that they might have. And after sort of seeing that, time and time again, and then going through an experience as a dad and my wife having a 15-month-old, sort of knew that there were way better ways for us to sort of provide care, address anxiety, and think about like patients in a more holistic way, right? Not just from the emergency department perspective or the behavioral health perspective or the social determinants of health perspective, to think about how you can actually provide sort of a layer of support for patients. I think that there was one stat that early in our journey we sort of looked at, and we looked at the amount of time a patient would spend with their OBGYN clinician during a 9-month period. And we did the math, and it was about 5 hours. And it turned out as we talked to patients, they didn't actually have the same clinician over that 5-hour period, right? And so they ended up seeing an average 4 to 5 clinicians over the maternity period. And so in that setting, it's hard to really build a trusting relationship. It's hard to figure out how you navigate. And it's independent of the resources you have. It truly is. And so for me and my co-founders, who's like an OBGYN and a tech-driven person, we just believe that we could actually provide a system where we build relationships with patients and truly believe engagement is key. and then focus on how we address all the different components in a holistic way, and be a really good point of contact for the woman throughout the maternity episode, which truly honestly starts pre-conception and extends way beyond delivery, right? And so that's what led us to start On Call Health, and that's what we've been sort of working on.
Excellent. Well, Leah mentioned, I mean, one, all of you guys are doing incredible work, and certainly as it pertains to, really large health issues, and certainly issues that hit communities of color, both urban and rural, and on reservations, and individuals who work in factories, a real gamut and diversity across this country. And as we know, there's 37 million women on Medicaid. Kind of the 75 million individuals on Medicaid. So it's the largest population outside of children on the program. It's also our future in this country. Our largest economic driver is people, right? And if you're not able to birth folks here into this country, we've got to bring them in. And so I do have a question around digital health myth busting. You talked, Leah, a little bit about some of the myths that you've encountered kind of in the role of building your company, but also in health technology or in digital health alone, and how communities of color utilize or use technology. Can you tell us how you guys as a company are addressing some of these larger digital health myths?
Yeah, I mean, I think the first one I mentioned in my opening was it was, especially when we first started working in Medicaid, there was a lot of skepticism that Medicaid recipients would have a smartphone, be able to use technology. And what we found is that not only do they have a smartphone, but they are more reliant on it because they may not have a laptop, right? And they are very avid users of their mobile devices. And what we had to solve for more so is the data plan might not be as reliable. So you have to have technology that works offline. So I think, but what we've seen in our data is that our Medicaid users are 30% higher rates of engagement, meaning sessions per month, retention in our application, time per month in the applications. So I think that's just a clear myth that Medicaid users don't use technology. The other myth that I think it would be interesting to hear both Olin and Juan Pablo given their work comment on, that I've seen, especially during this COVID crisis, is, Olin talked about the idea of relationship-based medicine and this really trusted relationship. And I think there has been a myth that has been that some people may have had, that doing remote care and video visits would diminish that relationship with a clinician. And I think we're seeing in COVID that it actually can extend it and make care even more accessible, again, to all demographics, and especially women who maybe are in rural communities or for safety reasons or for childcare reasons can't come in. And I know, Juan Pablo, you guys have really pioneered remote monitoring and patient care. And do you agree that that's sort of a myth that we can bust here?
Oh, absolutely. You hit the nail on the head. Number one, do women have the tools to use these experiences? To your point, yes, they have smartphones, data plans, there's an evolution of that. But they are incredibly engaged, and there's not just a myth from a public health department kind of perspective, but there's also a myth in the investor community. There's a heavy bias against investing in Medicaid. We're talking about structural racism in this country quite a bit. Like, there's a heavy issue there that needs to be addressed, because when we share our data with investors, we kind of get them rethinking about their entire investing strategy. And so I think there are plenty of myths, and to add to kind of the conversation, when you engage patients, you're able to create new models of care, especially in the home. And the current model of managing pregnancy hasn't changed in 40 years, which I think is obscene. And so as we think about the impact of technology, to what Leah mentioned, remote patient monitoring allows us to collect the same amount of data that's typically captured in the clinic now at home. And we're getting 10 to 20 times the amount of data that was typically being captured in the office. And so, all of these things, yes, COVID has accelerated quite a bit the conversation, but there's still a lot more to do, because a lot of people don't understand the power of these technologies in the delivery of care, especially in Medicaid.
Yes, and Olin, I know that it's a bit of an impossible topic for us to talk about in this short period of time. Can you talk about how the pandemic has really impacted or influenced the way that you guys are doing work?
Yeah, no, that's a great question. I think a lot of our work is tech enabled, but we do believe that there's a face-to-face component to it. As the pandemic has actually sort of evolved, I think what we've seen is there's a right balance and mix. And I agree with Leah and Juan Pablo, right? I think you could build really strong relationships with technology and asynchronous communication and truly getting a true understanding of the patient. Luckily for us, as we sort of think about, where we are in the stage of the pandemic and as we grow and scale, initially we thought people will be hesitant to have people come into their homes. And what we're finding is actually a little bit of the opposite, right? So there's an interest in sort of one-on-one interaction away from the typical waiting room that you might see in a clinic to address certain needs. And so there's a right balance, and if there's one positive around the pandemic is people sort of thinking about how you could actually utilize technology to increase access. And when we think about maternity for us, it's less tech driven like other fields like oncology or cardiothoracic surgery, right? It's all about like access, trust, engagement, and addressing like social determinants and behavioral health, right? It gets back to sort of healthcare 101, right? You got to build a trusting relationship to actually influence someone to do the things that you need to drive the outcomes that you want. The hybrid approach is working, and we're hoping everyone gets vaccinated and we're over COVID soon, but it is working for us.
Yes, and COVID is one thing, but some of these outcomes, specifically for Black women, Native women in this country, have been around for decades. So we've got COVID aside, we still have a long way to go. I'm going to wrap up. I mean, I think all of you guys brought up some incredible points, but one thing that Juan Pablo brought up, which is really important, I think, is about investment, right? In order for innovation and technology to get into communities, right? Like we have to have a way in which we spur that investment cycle. And in one way that is done is through philanthropic sources, it's done through investors. Sometimes the health system itself invests, whether it be a payer or a provider. But let's talk about some solutions as we wrap up today. I want everyone who watches our session to really walk away with an idea or a commitment to something that they could do to help advance such a huge issue in this country. And so, what are some last minute thoughts that you guys have, whether it be you're speaking specifically to, VC investment or policy or the healthcare delivery system and how it intersects with that lens of data, digital health, and health equity? Any last thoughts? Leah, do you want to start?
Yeah, I'm happy to dive in. I think something we're not talking about enough, and we did have a lot of time to talk about, again, this whole idea of health equity and not just having equal access to care for everyone, but making sure no matter what your color is, no matter your ethnicity, anything else about you, you're getting the same treatment, right? The same type of treatment, same quality. And I think one thing that we have begun to see as it relates to the C-section rate in maternity is just by having data and exposing hospital level C-section rates, we can begin to create transparency and bring it down. I think we should be doing the same thing on reporting on treatment and outcomes by different race, different demographic, and certainly income level, so that there's just visibility, both for providers for themselves to see what they may be doing differently, and also to inform maybe even quality incentives and how they're paid, so that we can just really bring light to this issue. And I think that's a huge opportunity that I hope we will see more of.
Yes, disaggregated data is definitely important as we're looking at these sorts of issues. Juan Pablo, any other last thoughts?
Yeah, so data is crucial in terms of like how I would suggest VCs change. It's a loaded question because we get VC funding, so I don't want to offend too many VCs, but I'll just do it anyway. I think what's important, and I think one of the challenges in the Medicaid space is that VCs pattern invest. So they have a bias to continue to invest in things that they have previously invested in that has already worked. And so the big challenge in this space is that you have to force these venture capital, and they themselves have to come to grips with they need to invest outside of their comfort zone. And the majority of, if we want to talk comfort zone in terms of like through a racial lens, absolutely, but there's also business model lenses and area lenses, because if you just look at the large, for example, IPOs in digital health, they're employer-based business models, but there's a whole world outside of the employer, and how willing are venture capitalists and investors to kind of go into the unknown. And I think that's the only way we're going to start funding these new innovative care models, is partners that want to go into the unknown together with companies like ours.
Yeah, and I think relying on the employer-based process might be very challenging, as we've looked at the amount of women who've left the workforce either forcibly or had to, made the choice to leave the workforce due to the pandemic. And so I think from an economic perspective and the impending recession, it's going to be more important than ever. Olin, what are your thoughts around understanding these linkages, and what would you like to see?
Yeah, I think that's a great question, because I think there are lots of different areas. I think there are a couple of things. We talk a lot about sort of Medicaid expansion, which is key, especially in the postpartum period, as we look at longer postpartum episodes. So I think on a policy front, that is a really important topic to move forward. I also feel like there's an opportunity for us to sort of align incentives a little bit better. And I sort of look at the analogy of Medicare Advantage. When Medicare Advantage started several years ago, it was a pilot, and there was not a lot of investment dollars going to Medicare Advantage. And I think by aligning to quality metrics and value-based outcomes, over time, we've seen a lot of successful businesses build innovative solutions to drive to the outcomes that we want. When I look at Medicaid and maternity, and I look at the quality metrics, and I look at how much it gets weighted compared to the overall quality metric for like health plans in states, I do think that there's an opportunity to sort of call out and align incentives better to make it more financially attractive to lead to investment dollars, right? And I think the venture capitals will go where they believe that there is opportunity, and by demonstrating that, I think we'll be able to sort of drive to better outcomes in the maternity space.
Excellent. Well, it has been such an amazing time spending with you guys here today, and we have lots ahead of us. I mean, we have to start talking about real solutions, and we're going to really need to focus on how we can better serve all women, but certainly vulnerable women in this country, and infusing innovation and technology as a part of our solution set. Thank you so much.
Thank you.
Thank you.
Thank you.